All right, welcome back, everybody, and we're so glad today to have one of our newest coaches of One Team Professionals, Rick Orchard, with us, and he is the founder of Vantage RX Testing Solutions. And Rick, it's good to have you aboard today.
It's good to be here. Thank you.
Looks like
in my car, as you can tell.
Yeah, you're in your mobile office, I can see. So anyway, hopefully we have good cell service all the way through, or internet connection. So that's good.
Hopefully.
Yeah.
Can you hear me okay?
Yeah, we can hear you just great. I think it's fine. Let's talk a little bit about today. Of course, we did a little bio to explain the background, which you've been in health and wellness for the past 40 years and done a lot of significant, impactful things over the course of that time. And the most recent thing, or one of the most recent things I think we want to really dive in today is the testing kit for the COVID-19 finger stick test. And so let's talk about that, what the advantages are, and just kind of give us a real overview of putting that out there and kind of where we're at today, if you could bring us up to date on that.
Okay. Well, when the pandemic first started, initially, at the very get-go, there was a PCR test, which is the nasal swab, that you had to send off to a lab and get the results. That was the first one because that has existed forever. Then quickly after that was our rapid antibody test. It's a finger stick test. The reason I like this test, and well, let me back up. There's three kinds of tests. There's the PCR that you've all heard about for the last 8-9 months. There's now the antigen test, which is a rapid test. You get those results in 15 minutes. That's a nasal swab also. So in my opinion, there's no need to send it off to a lab anymore. And then there's the antibody test, what we're going to talk about today. The reason I like the antibody test is basically three reasons. It's rapid, so you get the results in 10 minutes. It's a finger stick. Blood doesn't lie. The problem with the nasal swab is it really depends on how accurately someone collects the specimen. That will dictate the results of the test. So the test might come back, have a false positive or a false negative, depending on how the specimen was collected by the nurse practitioner or whoever's collecting it. Well, with blood, you don't have that problem. Blood doesn't lie. And it's easy. It's not invasive. You prick your finger. Heck, a third of the Americans have diabetes. They prick their fingers several times a day. So that's easy to do, and it's non-invasive, and it doesn't lie. So what does the antibody test tell us? When that virus enters our body, about 4 or 5 days later, we're all a little bit different. Our body creates an antibody called the IgM, as in Mary, and that antibody says, hey, something is foreign in our body, doesn't belong here. Then around 9, 10, 11 days later, our bodies create another antibody. It's called the IgG. I say that stands for good. And that antibody says, okay, I'm going to go to work and I'm going to go fight this thing. So the antibody tests for both antibodies. So if you prick your finger and 10 minutes later, it looks like a pregnancy test, by the way. It's just a little cassette. So think of a pregnancy test. So you prick your finger, you drop a drop of blood in, you put a drop of buffer in, and 10 minutes later, if the result comes back says you have IgM, antibody only, that tells me, okay, you just got the virus. Symptoms or no symptoms? You have the virus. That is the early notification. There is not a test on the planet that you can test and says, oh, 5 seconds later, the virus entered your body. That doesn't exist. So that's your early notification. If you test for the IgM and the IgG antibody, that tells me that you've had it in your system for 10 to 15 days or so, and now you're starting to build up antibodies or immunity in layman's terms. And if you have the IgG only, that tells me that you had the virus and now you're building up an immunity. You could have had it 2 weeks ago. You could have had it 3, 4, 5 months ago. So that's what the antibody test does. It tests for both antibodies, and depending on which ones you have, indicates a window of time, how long ago you've had it, if you have it, or it tells you a story. It's not just a snapshot like the nasal swab that says, yes, you have it, no, you don't. The antibody tells you more information. So I'm going to stop right there and see if anyone has any questions so far. Is that what you want to do, Mike?
Yeah, we'll go ahead and open that up. If anybody has any particular questions, go ahead and unmute, and you can ask Coach Rick at this particular time.
I think that was wonderfully simplified. So perfect.
Good.
Okay. And who
well,
was that?
Obviously, this is applicable.
Go ahead.
This is applicable to all of your clients, and I don't know what your industry is. If you sell real estate, if you're a doctor, if you're an accountant, it doesn't matter. This is applicable to all of us as individuals, but to every employer, especially now that the vaccine is going to be starting to be given to us peons. You know, if we're not politicians and we're not first responders, and so pretty soon it's going to be starting to give to everybody. So this test is going to tell you, hey, I got the vaccine. Is it working? Well, this is how you're going to find out. This is the only test that will answer that question. Is the vaccine working? Well, prick your finger, and 10 minutes later, you've got your answer. Or I am now eligible to get the vaccine. I'm a little nervous. I don't know. You know, it's so new. Are there side effects? No one knows the answer yet. I'm a little nervous. Do I need to get the vaccine? Well, prick your finger. If you have the IgG antibody, the answer is no, you don't need to. You already have it, whether you realize you have the virus or not. So the virus is interesting. One family last week that I know about is typical of a perfect story of what the vaccine is like. A family went to somewhere for Christmas and someone got COVID, and so they come back. There's 4 in the family. One person did not get the virus. The other 3 did. One member in that household had a headache for several hours. The other one had a fever and didn't feel good like the normal flu for about a day and a half. The third one wanted to die, deathly sick, for about 5 days. Same household. They're all related. So how the virus affects us completely depends on our personal immune system. So a lot of people have had the virus and not even know about it because they were asymptomatic. Mm-hmm. But anyway, the finger stick test will tell you, do you need to get the vaccine? Or if you get the vaccine, is it working? Okay. So this is applicable. Here. Yeah.
Just a quick question here, Rick. So this would really kind of eliminate the need for being quarantined as well, too. So, I mean, just for instance, this week I've got 2 kids that are home in quarantine. They don't have the virus, but they possibly could have been exposed. So they've got to spend 2 weeks at home doing online schooling rather than being back. So this would really eliminate that process too, wouldn't it?
It would. And it really bothers me that people are home for 2 weeks when it's unnecessary. Because if you take this, if you prick your finger in 10 minutes, you're going to know
Yeah.
if you have the virus or not. If you don't, that's good news. And if you do, and if you have the IgG, again, I say that stands for good, great. You're building up immunity. You can go back to school. Yeah.
Yeah. Yeah.
Now, again, no test will measure the virus for the first 5 days. So if you were exposed to someone 2 days ago and they got tested and they're positive for the COVID-19, wait 3 days. There's no point in testing because I can tell you that the result's going to be negative. I already know the answer. There's no point to it. But after 5 days, after you know you've been exposed, and that's the tricky part. How do you know? But that's what the test does. It tells you if you have it and if you had it.
Right.
Okay.
You know, and you've got some great videos that explains some of these things as well too. And one of the ones that I was watching personally was the fact that to get the results back, there's only like 18,000 machines that can tell you the results of a rapid test. With 1 million doctors out there, this could really fill that void and do a great service.
Well, that's right. When Abbott came out with theirs, and that hit the news, and everyone knows about the Abbott test. Again, it's a rapid test, but it does require that machine to read the results. And there's only X number of machines. And we have 1 million doctors. So now this is available to every doctor. Everyone can get testing. The FDA has not yet approved what they call an at-home use for any test yet that's related to COVID-19. You know, we can go walk in the grocery store and buy a pregnancy test. We can get diabetic test, but they haven't approved that yet. So this test needs to be administered by a healthcare provider, whether that's a doctor, nurse practitioner, an NP, a PA, RN, anyone. So we're selling a lot of these to employers because they want, for obvious reasons, to test their employees to see if they can come back to work, or to tell their patrons our employees are COVID free. Come to my restaurant, come to my business, you're safe.
Right.
All of those employers are hiring someone, a nurse practitioner, a PA, somebody, to administer the test. It's not hard to prick your finger. Any of us on this phone call can do that, but the FDA says we're not smart enough, we can't. So you do have to have a healthcare provider administer or oversee the test. A telemed visit is fine. You could be home and the doctor's on the phone doing like we're doing right now, a Zoom meeting. That works. But just FYI, we can't just sell these employers and start testing ourselves. We just can't do that.
Right. And so the two biotech labs, was it Heligen and Premier, I think, came back with the results of how effective and how accurate these tests are. You want to speak to that?
Yeah, okay, great question. I'm guessing none of you have been in healthcare your entire career. So for the last 50 years, every lab has to get a CLIA license to be a lab, and they oversee every single test known to man. And in order to get what they call a high complexity CLIA certification, that's your really complicated DNA test, for example. The federal government considers a test to be excellent. That's the technical term, excellent, if it has an accuracy rating, a sensitivity and specificity rating, layman's terms, if it's accurate, 95% of the time or higher. So forever in the medical community, if it has a rating of 95% sensitivity and specificity, that's really good. That's considered to be excellent, okay, or greater. Our test, I'm in the car, so don't quote me. Sensitivity is something at 98 point something, or close to 99%, and the specificity has been determined by several third-party university case studies to be 100%. Now, in medicine, you're never supposed to say 100%. 99.99% you can say. You're never ever supposed to say 100% in medicine.
Right.
The point is, it's very, very accurate. It is more accurate than the PCR test. More accurate.
Okay. And the documents that actually back that up?
Oh, yes, absolutely. We have the case studies. You bet.
Okay.
And I don't want to get political, but it's interesting after the election, all of a sudden in the news, they're saying, oh man, there's a lot of false positive tests with the PCR test. They're too sensitive. Well, in healthcare, we've known that forever. But now they're starting to be honest now that the election's over with and admitting to that. So there's been more people reported to be positive than really were.
Right.
Bottom line.
One other question here. What's the lowest level of healthcare provider? I mean, is it an LPN, a PA? Who is qualified as a certified practitioner at the lowest level? If that makes sense.
Well, they're all kind of equal. A nurse practitioner, a PA, registered nurse, doctor. Okay. Now, in reality, when you go to your doctor's office, does he administer the test or she administer the test to you? No. Who does? Well, an MA walks in. Medical assistant does that. Do they have a license? No. Are they working under the auspices of that doctor that you just saw? Yes. So in reality, the person actually pricking your finger probably doesn't have a license, but their boss who just saw you does. Does that answer your question?
Yes, I think so. And let's talk about how One Team members can take advantage of this. Obviously, we're set up as a distributor, I guess, or we've signed up with Vantage RX. So can you explain that process for potential One Team members who may not actually want to be set up, but they can actually go through our process as part of that?
Yeah, so when you're talking to your clients, you're an accountant and you have doctors as clients. You can say, hey, I know about this test that's available. And anyway, it doesn't matter who your clients are. You talk to them and they say, yeah, I'd like to buy some for my 1,000 employees or for my emergency room or whatever. They want to buy some. The process is simple. There's a one-page account setup form that they fill out, and we create an account in our system. And then we send out to them a welcome email with a username and password and instructions on how to place orders online. And they do. They place orders online, and we ship out the product to them. In the database, you're the distributor associated with that account. That's why we fill out an account setup form, and you have an ID number. So it's no more complicated than introducing clients to this, answering questions. If they stump you with a question, we're happy. We, meaning me and our staff, is happy to answer questions directly. And then they place the order. And then if they place the order once a week for the next 6 months, you're going to make a commission every time they place an order. It's a pretty simple process.
Well, that's what we're all about here with One Team, actually, is meeting our clients' need, being able to take care of them, helping people, but also creating multiple streams of income for our members as well. And I think this is a great opportunity and timely in the fact that we have this product and can be so significant and impactful, I think, here in this time.
Well, it's very timely here in our country, and of course, this is a worldwide pandemic. I mean, we're shipping these test kits out all over. You know, we have a 20 million order right now for Iraq for heaven's sakes, and 20 million units over there. So everybody has a pandemic. So if you have connections outside the U.S., you could talk to them also.
Yeah. And is this an exclusive thing that you have, Rick? Can I ask that? Is that a fair question?
Exclusive, no, but I have 2,400 account executives around the country that call on doctor offices. That's what they do. And so I have a personal relationship with the owner of the manufacturer. So I'm one of the few authorized distributors for the manufacturer. Do I have an exclusive? No.
Yeah.
But we don't need an exclusive. It's a big country.
Yeah. Very good. Very good. All right. Let's move on real quickly here in just a few minutes that we have left about the Vollara products, the Air and Surface Pro. Again, something I think is very timely. Can you speak to that just a little bit?
Yeah, so here's the bottom line on that. When NASA was developing the International Space Station years ago, they realized, Houston, we have a problem. Those astronauts cannot stay up there for months at a time, and they would kill each other literally just by breathing. So they had a major problem, and they had to fix it. And they did. They figured it out. And so our company, Aris, bought the rights to that technology. They paid them $10 million. And they, frankly, they improved upon it, and then they created a worldwide patent. So no one else has this technology. So here's what it does. An air purifier is really a misnomer because it does so much more than that. Air purifiers suck air into the air purifier, goes through a HEPA filter or a UV light, cleans out some air and spits the air out again. That's not what this does. This takes the oxygen that's in the air and transforms it into 3 different oxidized ions, and it sends out these molecules in the air 1,200 feet per minute and kills anything that's in the air and anything that the air touches on the surfaces. For example, last month, a lab in Texas that does a lot of testing for the military confirmed that when you turn this device on in a room, within 3 minutes, 99.9% of the SARS-CoV-2 virus is eliminated. It's gone within 3 minutes. 99.9%. Not only viruses that's in the air and on the surfaces, bacteria, pollens. Heck, 1/3 of us Americans have allergies. Well, you're not going to have itchy eyes or cough or sneeze anymore in your home. Cat and dog dander, molds. Anyone who's allergic to mold, gone. Eliminates, they call it Air and Surface Pro because it does kill anything that's in the air and in all the nooks and crannies and on the surfaces. That's what makes it so unique. It doesn't just suck air and clean some air, and then when it goes back out to polluted air, it's polluted again. It sends the solution to the pollution. It's unique. Nothing else like it.
Right. Right. Pretty amazing. Again, timeliness of that product as well. And one team has that available through our website now. There'll be more talk about that and the ability for additional income, however you want to utilize that. But goodness, you can almost talk to just about anybody. And there's a great concern now, and I think it will be a concern from now on, how we've kind of preconditioned ourselves now to be so aware of all these things, the social distancing, the mask, and all those types of things too. And I want you to tell this analogy one more time too about the mask and the relationships to the virus itself.
Well, 11 years ago, I created a documentary. It's called Truth About Pandemic Flu, which is kind of timely right now. The virus is 1,000 times smaller than a grain of sand. Obviously, we can't see it. It's pretty small. So here's my analogy. People ask me, will a mask protect me? The answer is no. It will protect you from spitting on someone else, but it will not protect you. And here's my analogy. You're standing 6 feet away from a chain link fence, and you have a grain of sand in your fingers. You throw a grain of sand to that chain link fence. Will that chain link fence stop that from going through? Nope. The virus is so small, as we're breathing, that's going right through the material, right into our noses. Just FYI. So the masks really don't protect you from the virus. Again, it does protect you from sneezing on someone else.
Right.
So if you had this device in your home or your business, you're good. You're COVID free. If every single American had this in their home and in every restaurant and in every office, we're good. We're safe. We're good. It kills it in the air because that's how it travels. It's in the air.
It's amazing. Well, I think there's a lot of opportunity for us out there. Hey, we're going to wrap this up. If you're joining us live, stay with us. We're going to have a time for more questions and discussions coming up here with Coach Rick Orchard. And I just want to remind everybody that our practice sessions are recorded and archived for highlights that are available anywhere, anytime, every time for all of our One Team members at oneteam.pro. So be sure to look for our scouting reports or log on to oneteam.pro to register and share with potential members about our upcoming practice sessions. Pros on Demand practice sessions are scheduled Monday through Thursday at 3 o'clock Central Standard Time. With that, we're going to wrap up this portion and this practice session of Pros on Demand.